My name is Amy Whitmore. This is Minnie, and my D number is D411-05325, and this is NR 224, no, 304, my bad, head-to-toe assessment. Hand hygiene here. Hi, how are you today? My name is Amy. I'm going to be your nurse. I'm going to be taking care of you. I'm actually going to be doing a head-to-toe assessment of you. It's going to take about 20 minutes. Is this a good time for that today? That is great. Okay, so the first thing I need to do is verify your name and date of birth. So let's have a look at your armband. Let's see. I see Minerva Mouse here. You do prefer to go by the name Minnie. Is that correct? Okay, great. And your date of birth is, can you state your full name and date of birth? Okay, Minerva Mouse. 11/18/68. Thank you. A couple of quick questions before we get started. Are you allergic to anything? You're allergic to latex. Okay, let me note that. And are you in any pain today? Excellent, thank you. All right, so Miss Minnie here appears to be, excuse me. Her appearance seems to be appropriate for her age and ethnicity. She appears to be in good health, has good nutrition. She doesn't have any visible devices or equipment. Her dress is appropriate for the weather. She is clean. She's smiling. Her smile is symmetrical. She's acting appropriate for the situation. And again, whenever she came in here, she maintained good posture and gait and did not need any assistance. And she is sitting on her own right now without any trouble or leaning over. So, all right, Miss Minnie, so I'm going to ask you a couple more questions here. So, do you know where you are today? You are at the doctor's office. Thank you. I appreciate that. And can you tell me today's date? August 28th, thank you. And do you know why you are here today? Yes, you are here for an exam. And can you tell me who the president is? Yes, President Trump, thank you. Okay, so you are alert and oriented ×4 because I did already verify your name and date of birth. And that also indicates that you have a good GCS of 15 based off of some of our other assessments that we have done for you. So what I'm going to do next is I'm going to take some vitals. So we're going to check your temperature real quick. So temporally I'm getting a temperature reading of 97.6. Write that down. Let's see, let's check your pulse ox. Your pulse ox is 98% on room air. Excellent, that is great. Let's check your blood pressure. We're checking your blood pressure going up, down, 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 down. Oh, you have a great blood pressure, 118/78. And I'm just going to check your pulse. And I'm going to check it for a full minute. Okay, so we're going to say that was a minute. Miss Minnie, your pulse was 74, and while I was checking your pulse, I did note that your respirations were 18. Your rate is regular and even, and your respirations were just normal. Okay, so let's have a quick overall look at you here, Miss Minnie. Okay, so I see that your skin tone is even and clear, and your color is appropriate for your race. I don't see any lesions or discolorations. Looks like there might be a minor bruise there. I don't know if that's a bruise or you might have just gotten a little dirty, you know, hanging out and playing at the clubhouse. I do not see any other scarring masses, visible devices, anything, wounds of any sort like that. Let's see if we can assess capillary refill here is less than 2 seconds. Go ahead and verify it on the other finger. That's great. Your skin, using the dorsal side of my hand, is warm to touch. That's wonderful. And let's check your, let's see. And it looks like no tinting noted, so that means your skin has a good turgor to it. Okay, that's great. So now, Miss Minnie, if you don't mind, I'm going to get you to look at me. Great. So I see that your head is normal cephalic and it is symmetrical. I'm not seeing any distortions of the sort. I'm not seeing any lesions, discolorations, scarring, masses, any other visual deformities. I do not see that your ears are pierced, although I do see a beautiful bow on the top of your head. Let's see, can you show me your teeth real quick? Can you smile for me? Excellent, you have a beautiful smile too. Thank you, Miss Mouse. I see that your smile is even and symmetrical. I see that all teeth are present. Let's see. Where is my, oh goodness. Okay, I need to take a quick pause. Sorry about that, I needed my pen light. Okay, great. All right, Miss Mouse, so let's finish up here. Okay, so I need you to smile. Let's see all of your teeth. All right, that's great. Can you close your eyes? Can you lower your eyebrows? Can you puff out your cheeks? All of that tells me that cranial nerve 7 is intact. That is excellent. So now I'm going to check on some of your lymph nodes here. We're going to check the preauricular, the postauricular, the occipital. Let's see, let's get the submental here, the submandibular, and the jugulodigastric. I do not know, I'm actually not able to palpate them. They are not tender and they are not rigid at this time, which is great. So let's have a quick look at your eyes. I see that both eyes are symmetrical. Miss Mouse, do you wear any contacts or glasses? No, you do not. Let's note that down. All right, let's see. I do not see any discolorations, lesions, infestations in the eyelashes or eyebrows. I see, I'm going to gently pull down your lower lid here. I see that your conjunctiva is pink and moist, and I see that your scleras are china white. Now, I'm going to use a Snelling chart, and I'm going to stand back over here, Miss Mouse. I am standing at the appropriate distance. Now, what we're going to do is we're going to get you to cover one eye. I'm going to get you to read. We're checking your visual acuity as we do this. Let's cover your other eye and read. My goodness, you really are dirty. You must have been playing hard today before you came in at the clubhouse. Thank you for, making it here on time for me. But I see that cranial nerve 2 is intact, having checked your visual acuity. So now we're going to move on. So what I'm going to do is I'm going to shine a light in your eyes, Miss Mouse, so bear with me just a second. We're going to sit you up just a little bit. So what I am doing is I am assessing to see that the pupils are round, equal, reactive, and that they accommodate to light and movement, meaning that Perla is intact. Miss Mouse, I need you to follow my pen. We're going to go up, we're going to go down, we're going to go out, and we're going to go in, and I see that Perla is intact. That is excellent. That also means that cranial nerves 3, 4, and 6 are also intact. Now, let's move on to your ears, shall we? You have very lovely ears, and your bow is slightly in the way. So now, we're going to look at your ears. We're going to notice that they are symmetrical on both sides and that they are positioned appropriately on your head for you. Mine would probably be lower. Let's see. Do you have any hearing aids or piercings? No, I do not see that in either ear. Okay, so let's have a look at the external auditory meatus here. And I do not see any discharge or redness or swelling in either one. Let's see. I'm going to gently stand behind you real quick, and I'm going to whisper in each ear. I'm going to whisper, Mickey Mouse. Can you tell me what you heard in this ear? Mickey Mouse. Excellent. Thank you. And in this ear? You heard Donald Duck. Excellent. So that sounds like that would be that cranial nerve 8 is intact. Excellent. I did not notice any skin breakdown or redness behind the ears while I was there. And I'm also going to inspect your tragus, and I see that it is non-tender And I do not see any other swelling or skin breakdown noted there either. All right, so we are done with your ears. Let's move on to your mouth. Your beautiful smile. Again, we see that it is symmetrical. We see that the nose, actually we're not moving on to the mouth, we're going to do the nose, I apologize. Alright, so let's have a good look at your nose. You have a beautiful nose. It is midline on the face and it is symmetrical. Excuse me. Alright, so we're going to have a look at the outside. I do not see any redness, lesions, masses, or other deformities noted. Let's have a quick look inside. I do not see any septal deviation or foreign objects. I'm not noting any drainage. All right, Miss Mouse, I'm going to hold on one side. Can you please breathe in for me? Thank you. I'm going to hold on the other side. Can you breathe in for me? Excellent. You have, your breathing is patent on both sides, bilateral patency. That is wonderful. Now we're going to, I'm going to try a little smell test. So what I want you to do is close your eyes for me and tell me what you smell. Smell cinnamon? That's exactly what it should be. So since you did smell cinnamon, that means that cranial nerve 1 is intact. All right. Now, I do not see any other thing that we need to assess for the nose. So now we're going to move on to the mouth. All right. So again, your mouth is symmetrical. Let's look inside. I do not, actually before we look inside, we're going to have a look at your beautiful lips here. Your lips are pink with no cracking noted on them. Let's look inside. I see the gums are pink and moist. I see all your teeth are present. They are white. I'm not noticing any discoloration. I actually don't see any cavities or any other kind of teeth breakdown or gum breakdown at this time. Everything looks good. So let's see. Let's look up at your hard palate. Your hard palate is white. Let's go back a little farther. I'm going to see that your soft palate is pink and moist. I see the pharyngeal is present and the uvula. The uvula, it rises with pronation. That's right. Sorry about that. It does. Let's see. I see that the buccal and the mucosa are all pink and moist. Everything looks good inside your mouth. Now, I'm going to take a tongue depressor. Alright, so we're going to take this tongue depressor. We're going to pretend it actually is one. Alright, we're going to take this tongue depressor. We're going to hold it down and we're going to check for your gag reflex. That would mean that cranial nerve 4 is intact. Now, I want you to close your eyes again. Excellent. I'm going to get you to taste this. Oh, it is a little bit bitter. What did you taste? Cinnamon. Excellent. That means that cranial nerve 7 is intact. All right. Can you give me a big swallow? Yep, just like that. Thank you. That means that cranial nerve 10, the vagus nerve, is intact. Alright, so now what I want you to do is I want you to stick out your tongue for me and move it side to side. Great, that means that cranial nerve 12 is intact. So far we are doing excellent. Now, let's have a look at your neck. Your neck is kind of not there, but that's okay. We're going to work with it. Alright, I am noticing your jugular, I'm inspecting the jugular veins on both sides. That I see they are where they should be. I do not see any jugular vein distension or tracheal deviation. I see that the neck is, the head is midline on the neck and symmetrical. Let's see. Can I get you to turn your head from side to side? Wonderful. And let's get you to shrug your shoulders. And you know what that means? That means that cranial nerve 11 is intact. So, now we're going to check out those last little bit of lymph nodes. We're going to check your superficial, your posterior, your deep, and your subclavicular. And again, just like the others, they are non-tender, they are not rigid, and they are not actually palpable at this time, which is a good thing. So let's move on to respiratory. We are going to have a little listen, but first I need you to sit up for me, Miss Mouse. There we go. So now we're going, let's see, we don't need this. Let's check your, so what we're going to do is we're going to check your back first. This is your posterior side. I see symmetrical expansion. I see that your AP diameter is a 1:2 ratio, which is great. I do not see any masses or lesions noted at this time. And what I'm going to do is get you to say 99 while I gently palpate down your back. And what I am checking for is the absence of tactile fremitus, which is not there. That is excellent. Now, while we got you up there, please don't fall down. I'm going to auscultate. What I am doing is auscultating all lobes in about 6 to 9 places on both sides. Take a deep breath for me every time I move this. Deep breath, please. Deep breath, please. I hear that the lungs are equal or clear and equal bilaterally. All right, Miss Mouse, let's get you to kind of sit back here. We're going to put you in a high Fowler's position, if you don't mind. And I am going to listen to your anterior chest at this time. I'm also going to inspect it first. First, I do not see any masses or lesions. I don't see any deformities noted. If we were in the proper setting, she may be in a hospital gown, and being a female, I may ask her if I could expose her briefly just to actually physically be able to see what I'm looking for here. I do not see that at this time, but I am going to go ahead and auscultate. Again, I'm going to auscultate. I'm using the diaphragm of my stethoscope, by the way, to listen to breath sounds. So I am going to listen in all lung fields. I'm going to get you to take a deep breath each time. Excellent. I'm listening to in about 6 to 9 positions. And what I am hearing, just like in the back, that the lungs were equal and clear bilaterally. And I am also not noticing any accessory muscle use as well in her chest. So now what I need to do is we're going to listen for your heart. So what we're going to start with first is I'm going to flip over to my bell, and I'm going to listen for any bruits in your carotid pulses, and I'm going to make sure I do this on both sides. No bruits are noted, and I'm not noting any bruits here either. Now what we're going to do is we're going to auscultate the heart in the 5 points. We're going to listen to the aortic, the pulmonic, and these are, let's see, so the aortic would have been the second intercostal right midclavicular. The pulmonic is the right midclavicular second intercostal space. Erb's point is going to be the third intercostal space midclavicular line. Tricuspid, we're going down to about the fourth intercostal space, closer to the left midclavicular line. And then we're going to listen to the mitral, or also the apical pulse. And what we're listening for here, we're trying to listen to see if we can hear all of our heart sounds. I am hearing S1 and S2 sounds in all locations, and I'm going to go back with the diaphragm and listen one more time. So again, I'm doing aortic, pulmonic, Erb's, tricuspid, and mitral. And again, I want to listen to make sure that I'm not hearing, I'm trying to listen for the apical pulse. And it sounds regular, without any bounding or any extra sounds noted. I'm not hearing any murmurs or any other irregular discrepancies at this time. So let's move on to your belly. So what we're going to do first, because it's important whenever you're inspecting the abdomen that you go in the correct order. So the first thing is what I'm going to do is I'm going to inspect. I'm looking for any masses or lesions, rashes, anything of the sort that is out of the ordinary. Now what I'm going to do is I'm going to start palpating. So we're going to palpate. We're going to go in a clockwise. Pattern. Miss Minnie, are you having any abdominal pain at this point? No, we're still on a 0 out of 10 in your pain. That's wonderful. So if she had pain, I would wait to auscultate that quadrant. I would wait to palpate that quadrant last. But actually, I want to auscultate before I palpate. So I am going to auscultate in all 4 quadrants. We're going to start with the right upper quad, the left upper quad, the left lower quad, and the right lower quad. And what I'm listening for, and I'm going to do this for about 5 minutes, I'm listening for regular bowel sounds. I'm making sure that I'm not hearing any bruits, or I don't want to hear any hypo or hyper bowel sounds at this time. Everything sounds normal, and I do hear bowel sounds equally in all 4 quadrants. Now I'm going to gently palpate. So I am going to palpate again, starting in the right upper quad, the left upper quad, the left lower quad, and the right lower quad. And what I am trying to hear, or what I'm trying to feel, any masses, or seeing if there's any tenderness, rigid, guarding, distension noted, and everything. None of those were noted at this time. There was an absence of all of them. So I'm going to take a super fast pause for just a second. Okay, thank you. All right, so the next thing I'm going to do, I'm still in the abdomen. One of the things that I did not do that is extremely important is that I am going to auscultate the aorta. And it's important to use the bell at this point. What I'm listening for is are bruits, and the aorta is slightly left from the midline of the abdomen. So I'm listening. I do not hear any bruits noted at this time. So now I can move on to muscle skeletal. So we're going to put this out of the way, and we're going to check Miss Mouse for her range of motion. So we did this earlier, but we're going to check one more time. Miss Mouse, I want you to move your head from side to side, up and down. That's excellent. I want to get you to shrug your shoulders. Let's do some circumflexion in each shoulder. Excellent. We're going to do some dorsal flexion and extension, or actually just flexion and extension of your arms. Let's see. You want to do that? Awesome. You've got awesome hands. All right, so the wrist, of course, we want to do full range of motion, circumflexion. The fingers, we want to extend. We want to check each finger. We want to do this, of course, on all extremities. I can't do it as well on that one. Again, we're checking circumflexion. Your hips, you want to be able to twist your hips and bend down, touch your toes if you can. Checking the range of motion there in your hips. Your knees, again, you're going to bend, extend, and flex. And the ankles would rotate. Can we rotate your ankles in full circumflexion? So, Miss Mouse, did you have any trouble with any of that? Excellent. So full range of motion noted in all of these. While we're here, we're going to palpate the dorsal pedalis, the dorsalis pedis. I'm so sorry. And I hear +2 in both feet. Excellent. And I don't remember if we checked for radial pulses earlier. We do need to check radial pulses. And I feel +2 in both extremities. Excellent. Yay! So now we're going to go for reflexes. I do not have a little hammer, but we're going to assume This is my little hammer right here. So what we're going to do is we're going to check your reflex for your bicep. Yeah, that looks great. We're going to check your tricep. Awesome. Let's see, actually, let's do it on the one where you can see it a little better. So bicep, triceps, brachioradialis, and she would be able to get in this position to check that one. So the patellar, of course, is the knee. You check on the bottom part of the patellar, and then your Achilles, which is the back of your ankle, would check. And I don't know if I noted the brachioradialis, it's the back of the wrist. All right, so we checked all of those. Excellent. They are all present at this time, and they are equal on both sides of her extremities. Now, so we went through all of our cranial nerves already, so there is no other reason to go back and assess those again. We did check that her GCS was 15 earlier whenever we assessed her for her AAO times 4. I'm going to perform a little bit more hand hygiene here. Oh wait, before I do that, one of the things that I did miss was your strength test. We cannot forget that, because I know you're super strong hugging all those kids. So I want you to get up, I want you to push against me, and then I want you to pull against my hand. I'm going to push down against your hand. I want you to pull, push, 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 push. Now I want you to push, 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 push. All right, we did that in both hands, both arms, and now we're going to do it in your legs. I want you to push up on I want you to push up with your foot on my hand. Push, 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 push. Now I'm going to do it in the back. Push, 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 push. So we have 5 out of 5 bilateral on all extremities, both upper and lower. So that would be our strength test. We have already checked our reflexes. So now we're going to perform our hand hygiene, and I am going to go back and document everything that we have seen. That Miss Mouse was, of course, very cooperative. We did our full head-to-toe assessment. Miss Mouse, are you in any pain at this time? One more time. You're still at a 0 out of 10. Excellent. Is there anything else that I can do for you today? No? All right. I see you've got a little call light here. We're going to put it right here. If you need anything, can I get you a warm blanket or anything else to make you comfortable at this time? Wonderful. All right. Well, thank you very much for letting me assess you today. I appreciate it, and you have a wonderful day. Go back and enjoy having fun in the clubhouse. All right. Thank you. I'm doing hand hygiene one more time, and I'm out the door. I appreciate it.